topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, we are back again with our Dallas, Dallas-Fort Worth area show. And this show here is without a doubt one of my favorite shows because I have learned over the year how much when you're overweight, how much it affects your health. And I've been learning this for the last year. I mean, I will admit I'm on the skinny injection. I'm not embarrassed about it. It works. I've had no trouble with it. Today's show is going to be probably the easiest because normally I've got all these questions for our great guest, Dr. Gamboa of Elite Care Clinic. But you, our great audience, have written in so many questions that I'm just going to use your questions today, and hopefully we answer everyone's questions. Good afternoon, Dr. Gamboa.
Hi, Steve. How are you?
I'm wonderful. You know, we're replaying your show now because Dr. Gamboa, when it comes to being overweight, I was surprised that it can cause death. I mean, I hate to put it that way, but it can really affect so many things in your health, like in my case, my kidneys. So this is an important show to do, right?
Yeah, like as you said, like a lot of the times we don't realize how much the extra fatty tissue that we have is going to cause problems to us, like from insulin resistance to like increasing your risk for like cardiovascular disease, fatty liver, and even cancers and so forth, like then you develop obstructive sleep apnea, then you get less oxygen to your brain, less oxygen to your heart, and the list goes on and on. And it's been amazing to be here to at least teach everyone and share the knowledge that I have to like educate patients and people that are listening, because this is so important, and then maybe one of the few positive things that we can get from COVID, this is one of them, because finally a pandemic had to happen that we shed a light on how important was, or how much like how many complications that patients could have whenever they were overweight or obese. And that's how like we started seeing more things about, maybe like being overweight and overweight. We were telling everyone about this all the time, but finally we saw the real effect and how it affected people, and then that's how we started like thinking, let's start treating it. But until the obesity is not recognized as a chronic disease, not a lot can be done. And yes, it's been better. Every year it's been better, like coverage of these medications has been a little better. However, until like the government, until like Congress, until everyone and insurance companies, they say, hey, yes, obesity is a chronic disease, then it's going to get much better. But we have to keep fighting, we have to keep pushing for recognizing obesity as a chronic disease.
Well, I got to tell you, I am so upset that these insurance companies, now I'm on Medicare, and Ozempic is quite expensive and it does pay a lot. But for people that aren't on Medicare, I'm upset that these insurance companies do not cover this because it would seem to me it would save them so much money in the long run.
And that's what we as physicians also we're trying to like show insurance companies that in the long run it's going to be much better. I mean, unfortunately some of them they just see like the right now how much they're spending money on these medications, but in the long run, you know, like if you're going to be healthier, like you're not going to develop obstructive sleep apnea, or if you did then you're going to get better, you're not going to use a machine, then you're not going to develop diabetes, or you're going to have your diabetes in remission, or like you're not going to continue with like damaging your kidneys, it's going to get better. So many things that are going to get better, you know, at the end you're not going to need like a heart cath, a stent, like you're not going to be like hooked to the dialysis machine, but everything is going to take years, and it's going to get better. But I mean, unfortunately they don't see that way, you know.
You know, we had a lot of people write us. There's a lot of gimmicks out there, and I hate gimmicks because I probably tried them all. They don't work at all. But there's starting to talk about now there is an oral that works just like the injection. Is that right?
Well, yes, the branded
It's a
name is
pill.
called Ribelsus. Yes, it is a pill for patients that are a little bit more reluctant to use injections. You know, like there is the oral version of it. It's also semaglutide. It's the same peptide as the Ozempic for diabetics and Wegovy for weight loss, but it's an oral version of it. You know, and this is a special um, chemical composition and tablet because it has to have a little bit of like protect the peptide not to be digested and all that before it gets to the receptor. So the way you have to take this medication, it has to be on an empty stomach, and you have to wait at least 30 minutes before eating anything. And it's pretty good. You know, I have a few patients that had great success with it. One of my patients, like she is diabetic, and she was not even able to go to the highest dose because this one comes in 3 milligrams, like 7 milligrams and 14. And with only getting to 7 milligrams, she was able to lose near 50 pounds. And then I had to like lower her dose to the 3 millimeters and that milligrams, sorry, and that has been her maintenance dose because like that is keeping her diabetes in remission. She is like she's keeping her weight in a healthy range, and she's very happy with it. So I had a lot of like patients that had really good results and success with the Ribels, but it has to be this one. I cannot say the same about the compounded oral semaglutide. I really don't know how that works. I don't know if they have the same coding. I really cannot tell you about that.
I've heard some things about the compounds that you have to be really careful, and you should do this under a doctor's care.
That is correct, Steve. You know, like either compounded or not, you definitely have to be followed by a physician that is trained in obesity. Not only any physician, because a lot of the physicians they think that they can prescribe it and they can just give it to you, but honestly they have to have some like training on in obesity to really know how these medications work, how you are going to titrate, how to avoid adverse effects, how to help the patient, what else we can do to help them, because also these medications, these injections are not magical. You know, like you also have to change your behaviors, because if you think that you're going to use an injection and then you're going to continue doing all the sodas, all the pizza, all the hamburgers and everything, and all this fast food as usual, unfortunately you're not going to be successful in your journey, you know. And this happens with anything. It's not only the injections, it also happens if you decide to do a bariatric surgery, which is like it's good for some indications and for some patients, but if again you do not change your behaviors, you're going to regain all the weight back, and then there's going to be nothing else to cut because like your stomach has been already reduced to the size of like a banana kind of thing.
We got here's a text from I guess the Corsicana. I'm curious. I'm on the injection. I see ads that show people giving the injection in their leg, but I was told to give it in my stomach. Which do you prefer?
Sorry, Steve. Like I think we got caught up a little bit. Like I didn't hear you.
We had a, can you hear me okay?
Right now, yes, it was a little cut off, and I think the for something like the internet, I guess
Text from
something happened.
Corsicana, Texas, and they want to know they're on the injection. Their doctor told them to inject in their stomach, but I see on ads they're injecting it on their leg. Which way do you prefer?
Well, like both both places are correct. You know, you can do it around your belly button, in your stomach, or you can do it on your legs. And it depends on the patients. You know, like some patients prefer to do it in their leg, but some patients feel that in the leg they feel a little bit more. So they prefer to get like a little pinch here and then just like go ahead and do it in your stomach. So it depends on you, honestly. Both places are correct, and you can do it any place. Some people also did it in their arms, in the back of the arm, you know, like so. But again, a lot of patients don't like to do it there because you're only basically using one hand versus two. So it's much better if you do like
Yes.
in some place that you can use your two hands.
So I want people to know because I hate needles, Dr. Gamboa. I can't stand needles.
You're
Blood
not alone,
drawn,
Steve.
any.
Like patients do that.
But I want to tell people because I think a lot of people have st- shied away from the injection, thinking, "Oh, I got to give myself a shot in my stomach." I got to tell you, I have to look down to make sure the needle's inside because I don't feel it. The needle is
It's
so
very
small,
tiny.
right?
Yes, they are very thin. And always like make the analogy. It's like kind of the size of like an eyelash, to be honest with you. So like
Yeah,
it's not like a huge. It's not those needles that they use to like draw blood or anything like that. They're very tiny, and again, like you don't feel it as much, honestly. I mean, sometimes it's just the perception or the idea of a needle and pinching you, you know. But in reality, it's nothing like that. It's very small needle.
this is from Garland, Rick and Garland. Hey, I love your show. I found it about a month ago. I watch it now every time. I want to know, are you concerned about the bird flu?
Hey, thank you. Like, well, right now, like they're looking at it, you know, like, and I think anytime there's like a viral infection, we should be some concerned at some degree because we already know what happened whenever we're not concerned at all and we saw what can happen. But I think overall, we have to be a little bit better with protecting ourselves and protecting others. So if you're feeling that you are with fever, coughing, and you have to get out of your house because you have to do like some errands, please wear a mask so you're not spreading the love, you know. And the same thing happens this time. I've been seeing a lot of people with influenza, you know. So like this time, a lot of hospitals were a little bit backed up with the flu. So and I understand a lot of people are reluctant to get the immunizations, vaccines after all what happened. But look into that. Like the flu vaccine, it's like it's not going to prevent from you getting sick at all, but at least it's going to make it uh, less complications, especially if you have chronic diseases. If you have asthma, if you have like emphysema, then try to think about getting vaccinated. And the bird flu, the same thing, you know, like again, if you're feeling that you're sick, and either do not go outside, or like if you have to like wear a mask so that you protect others. It's going to be like that. Remember how what happened the H1N1 also, you know, like we had for some couple of years ago, like also that. So
Do
It's one
those
of
masks really work?
those viruses that if they are respiratory, then for sure we can get it. You know?
Did the mask really work, Dr. Gamboa?
Cut off, like I couldn't hear you.
Okay. Do the mask work?
It works, you know, like for the ones that are like, for example, if you're, because remember all this respiratory, I know it has like a bad reputation also and all this what happened, but truly if you think about it, whenever you sneeze, you're spreading all this like droplets everywhere, and then whenever you're sick, that's how you give it to people, you know. So like mostly whenever you're wearing a mask, it's to protect others from spreading and spreading and spreading the virus, you know, because again, anytime you cough, droplets go flying all over. Like sneezing, go the same thing. So so that's why it's like it should be more like being more respectful from others, you know, and considerate. So I think that should be like a good practice, you know. And also, you know, if you have chronic diseases and you're going into an office, medical office, a lot of patients, they may be incubating the virus. Because I had a lot of patients that they say they find that morning and at night they start having the fever, and then they test positive for flu or they test positive for COVID. But then in that period of time, they contaminated so many people because they didn't know they were sick, you know,
Right.
because they were talking, they were doing stuff, or they sneezed once and they were like, oh, I'm okay. But that's why, like, we have to always like protect ourselves.
Uh, Beverly in Irving, that's close to you.
Oh yeah,
She
yeah.
wants she wants to know what is the best way to help your immune system.
Excellent question, Beverly. So, to help your immune system, we can do many things from the point of view. Uh, First, like, let's go ahead and start with our gut, okay? Because our gut is the first thing, or kind of like a first line of defense. So, make sure that we all do probiotics because we need all the good bacteria. There are so many probiotics that are going to help boost our immune system. They're going to help not only like digest the food better and decrease your bloating, but also they are going to help tremendously with the production of serotonin. So then the next thing you can do is boost your vitamin D. Vitamin D, again, with the COVID, we learned that whenever patients were having very low levels of vitamin D, their outcomes or like were worse, you know, like they were more complications. So vitamin D, zinc, and your traditional and you know well-known vitamin C. So usually whenever someone is like getting sick, I recommend them, hey, go ahead and start taking emergency immune, those little packets that they have vitamin C, vitamin D, zinc, and that should help you with that. Another natural way of boosting your immune system, you can do elderberry, you know, like that's another
Yeah.
supplement that
Oh,
you
yes.
and that's usually what you do.
It's amazing. You brought up about elderberry. I've heard that it's really good for your immune system.
Yeah.
Um, God, I've got so many questions here. Barb in North Dallas, I heard you talk about biohormone injection. Can you tell me what it's a replacement? I understand that. Can you tell me exactly how that works?
The I hope she's talking about like bioidentical hormones. Is that right?
Yes, the
Yeah.
replacement, biohormone replacement.
Yeah. So like the bioidentical just means that the chemical structure of your uh, hormone is identical to the one that I'm replacing you is going to be identical to our own. So that's why it's not going to be synthetic. And then for women, we don't have the injections yet. But for men, yes, they came up with the injections for testosterone, you know, like the testosterone injections. And now they're like much better because like now they can use it similar to the injections that are for weight loss. They can put it around their belly button. They're subcutaneous or in their leg, but not in the muscle, just in the subcutaneous muscle. And then they can do it every week as well. And this newer versions of like the testosterone um, are more likely to maintain those levels. They don't make those peaks. It's not like a roller coaster like it used to be with the older versions of the testosterone. For women, we don't have injections yet. For women, what we offer is the estradiol pellets, testosterone pellets. Those are again bioidentical. And then like the progesterone that it's taken by mouth. Options also are like testosterone cream, testosterone sublingual tablets, and or even testosterone gel. But injections for women, we don't have them.
Uh, Norman, I'm trying to get as many people who wrote us earlier, but we're getting a lot of text in. Norman wants to know, he said, I use your show. I travel a lot in my car, and it really helps me get through the day.
Thank
We
you.
love hearing that. You mentioned pellets. I'm very interested in that. Can you talk more on pellets?
Of course, so pellets, as I was mentioning before, it's a bioidentical hormone replacement method, and they are subcutaneous, meaning they're going to be on your fatty tissue. They are great because they do not make the peak, do not make that roller coaster effect that they go drop the level down. So they are going like within 2 weeks from the insertion, they're going to like go the levels up, and then they're going to maintain those levels. In guys, like you normally do like every 5 months. In females, we do it every 10 to 12 weeks, like, but also if let's say like whenever we replace your testosterone, you're going to feel much better, like the drive, like you're going to have this mental clarity, you're going to feel much, much better, then maybe you're going to decide to run a marathon. So if you run a marathon, you do more physical activity and you're more active, a lot of the times you may consume the pellets a little bit sooner. So it could be a little bit earlier than the 5 months, but that's usually how long they last. And speaking of testosterone, I'm going to take advantage and then give you a little bit of like a trailer, right? I'm going to like tell you that I am in the process of getting my fellowship on testosterone replacement, and I've been
Oh,
fortunate enough to be able to start this fellowship with one of the testosterone gurus, Dr. Morgenthaler. He's one of the pioneers of the testosterone replacement, debunking a lot of myths about like testosterone is causing prostate cancer and other things. So like I'm really, really fortunate. I'm so happy that I am doing this fellowship with him. And so I'll tell you more about next times, like once like I'm going to
you're going to
graduate from
have to
this
get a
fellowship, I'll tell
Dr. Gamboa, you're going to have to get a bigger office. You're going to have to bring another doctor in if you're doing all this.
you. And then I can share all the knowledge with you guys.
Dr. Gamboa, I got to tell you, I've got enough questions to ask you for the next 5 shows, but we'll get to those.
Keep
You're going to be
fire,
back
keep
again with
fire
us
still.
next
Like,
month.
let me see what I can help you
You
with.
got a fan club. It's amazing. Tell people how they can reach your office.
Sure, like they can call my office at 469-947-6020. And I'm here in Las Colinas, Irving. And it's very close to, I would say like 114, but
Yes.
very close to like a Starbucks also. Very important.
Well, I got to tell you, do such a great job with your show. It seems like we've been doing the show forever. We'll be repeating this show again next week. Dr. Gamboa, thank you so much. Have a wonderful week, and God bless you.
Thank you so much, Steve, and keep up being healthy every day. Take
We
care.
love
You
you.
too. We love you too.
Dr.
Bye bye.
Gamboa, Elite Care Clinic. She's amazing. Hey, that's it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.